Today we're going to talk about a subject that raises a lot of questions and worries many people. Thyroid problems and their impact on weight. Do people with thyroid problems tend to put on weight or lose weight? And what happens after surgery? Stay with me and I'll clarify everything. If you've noticed changes in your weight or even tighter clothes, you may be wondering, does this have to do with my thyroid? Let's dispel these myths and understand what really happens. The role of the thyroid in metabolism. The thyroid is a small but extremely important gland located at the base of the neck. It is responsible for regulating metabolism, which is nothing more than the speed at which our body burns energy to carry out its basic functions, such as breathing, thinking, and keeping the heart beating. When the thyroid functions insufficiently, a condition called hypothyroidism, the metabolism slows down. This can cause symptoms such as tiredness, feeling cold, and in some cases, a slight weight gain. On the other hand, when it works in excess, hyperthyroidism speeds up the metabolism, which can lead to symptoms such as anxiety, excessive sweating, and even weight loss. Myth and reality. Now, you might be thinking, so, if my metabolism is slow, I'll put on weight, and if it's fast, I'll lose weight. Well, the relationship between the thyroid and weight isn't that simple. Not all cases of hypothyroidism result in significant weight gain. On the other hand, not all cases of hyperthyroidism lead to considerable weight loss. This is because body weight is influenced by many factors such as appetite, eating habits, physical activity, and even body composition. For example, some people with hyperthyroidism may even gain weight because the increased metabolism can generate more hunger, leading them to eat more. So it's important to understand that the thyroid plays an important role in metabolism, but it's not the only factor that regulates our weight. It's always necessary to assess the whole picture with tests and medical follow-up. Thyroid and obesity. When we talk about hypothyroidism and weight, it's very important to demystify a common idea. Hypothyroidism is not a cause of severe obesity. What it can do in some cases is contribute to a small amount of weight gain, mainly related to fluid retention or changes in metabolism. Obesity, on the other hand, is a much more complex condition. It involves various factors, such as poor diet, physical inactivity, genetics, and even emotional issues. In other words, the thyroid may be one of the factors, but it is hardly the only or main reason behind obesity. Thyroid nodules. Now let's talk about another point that generates doubts. Thyroid nodules. Many people are worried when they discover nodules, but it's important to know that they don't always affect the function of the gland. If your hormone tests show that your thyroid function is normal, these nodules won't interfere with your weight. You can have a thyroid full of nodules and it can still function perfectly well. This is because nodules are structural changes, while thyroid function depends on hormone production. That's why it's essential to assess the thyroid thoroughly, both with imaging tests, such as ultrasound, and with blood tests that analyze hormones. Each case is unique, and not every nodule is a cause for concern. Thyroid surgery and weight. Common questions. One of the most frequent questions I get is, if I have thyroid surgery, will I gain weight? This doubt is very understandable, but the answer is no, as long as hormone replacement is done properly. When the thyroid is removed, either completely or partially, the body needs the hormone it used to produce, and that's where levothyroxine replacement comes in. This treatment is adjusted to mimic the natural function of the gland, ensuring that the metabolism remains balanced. This is why post-operative medical follow-up is essential. They will monitor your hormone levels and adjust the dosage until they find the right balance for you. With adequate replacement, the surgery shouldn't cause significant changes in weight. Further clarification. Another question that often arises is related to thyroid hormone replacement and its impact on health, especially in patients with a history of cancer, such as breast cancer. It's important to clarify that thyroid hormone replacement has nothing to do with menopausal hormone replacement. Thyroid hormone is essential for regulating metabolism and basic body functions, while menopausal hormones such as estrogen and progesterone have other purposes and may be associated with different risks. Therefore, using thyroid hormone after thyroid removal does not increase the risk of breast cancer or any other problem related to menopausal hormones. This is a safe and fundamental replacement for your health and well-being. Investigation and treatment importance of diagnosis. When it comes to investigating causes for obesity or changes in weight, the thyroid should always be on the radar. This is because it plays a fundamental role in controlling metabolism. To understand whether the thyroid is contributing to your symptoms, it is essential to carry out tests that assess both the structure and function of the gland. This includes imaging tests such as ultrasound to check for nodules or changes in the thyroid's anatomy. Blood tests such as TSH, T3, and T4, which analyze hormone levels and help identify dysfunctions such as hypothyroidism or hyperthyroidism. Without these tests, it's impossible to determine whether the thyroid is actually influencing weight or whether there are other factors at play. Appropriate treatment. The good news is that if hypothyroidism or hyperthyroidism is diagnosed, treatment is very effective. In the case of hypothyroidism, hormone replacement with levothyroxine restores adequate thyroid hormone levels. In hyperthyroidism, there are different approaches, ranging from medication to definitive treatments, such as radioactive iodine or surgery. With proper treatment, thyroid function is normalized and it stops interfering with weight. This shows the importance of a correct diagnosis and medical follow-up, as they ensure that your health is balanced. So, if you're dealing with weight issues and suspect thyroid disease, go to your doctor and have a thorough investigation. Health starts with a good diagnosis. So, if you have thyroid problems, rest assured, with the right diagnosis and treatment, there's no need to worry about your weight. It's important not to get carried away by myths and misinformation. The thyroid has a solution, and medical follow-up makes all the difference. Thank you very much for watching this far. If you found this content useful, don't forget to like it, share it with those who need it, and subscribe to the channel. That way you'll help us reach more people and keep bringing quality content. See you in the next video. See you later.